Hello everyone. Now we are going to discuss about the cellular adaptations. Cellular adaptation when cell experience stress stimuli, it goes under some sort of adaptation. The first is hypertrophy. What is the definition of hypertrophy? Increase in cell size, not in cell number. Increase in cell size or increase in the size of the organ. This is known as hypertrophy. There is no new cell formation. Increased synthesis and assembly of intracellular structural components. It can be seen in many physiological or pathological conditions. So examples of physiological hypertrophy is uterine smooth muscle hypertrophy, which is seen in pregnancy primarily due to the effect of estrogen hormone. Skeletal muscle hypertrophy in bodybuilder or weightlifters. In pathological hypertrophy, increased workload of the heart result into the cardiac muscle hypertrophy. So these are the common examples of hypertrophy, physiological as well as pathological. What is the mechanism behind hypertrophy? It involves growth factors and direct effect of cellular proteins. Whenever there is increased workload or mechanical stretch, growth factor stimulates, or there are mechanical sensor integrins, they also get activated, and some agonists like alpha adrenergic hormones and angiotensin, and they ultimately result into the activation of signal transduction pathway and activation of some transcription factor, namely GATA4, NF80, MAP2, and they result into induction of fetal embryogenic genes, for example cardiac, alpha actin and ANF, which result into increased mechanical performance and ultimately decrease the load on the organ. The other mechanism is increased synthesis of contractile proteins. Increased synthesis of contractile protein, and which also increases the mechanical performance, and they also increase the production of growth factors, which ultimately provide a positive feedback to this cycle. So this is the mechanism behind hypertrophy. Main role of growth factors and direct effects of cellular proteins like alpha adrenergic hormone, angiotensin and mechanical sensors. Remember, these transcription factor involved in hypertrophy: GATA4, NF80 and MAP2. Thank you. Now we will see hyperplasia, another form of cellular adaptation. As we have seen, in hypertrophy there is increase in the cell size. In hyperplasia there is increase in the number of cell, and as the increase in number of cell is noticed in hyperplasia, so this mechanism is possible only in the cells capable of dividing. So examples of hyperplasia: physiological as well as pathological hyperplasia noticed. In physiological hyperplasia, growth factor and hormones play an important role. So example of physiological hyperplasia is breast during puberty and pregnancy. A glandular epithelial hyperplasia noticed in the breast. Along with the hyperplasia, there is some degree of hypertrophy is also seen in the breast during puberty and pregnancy. Liver Regeneration after resection is also an example of hyperplasia. Bone marrow is also show hyperplasia after acute blood loss. Pathological hyperplasia, endometrial hyperplasia, benign prostatic hyperplasia, skin warts, particularly in HPV induced skin warts. So these are the examples of pathological hyperplasia. Now we will see the mechanism of hyperplasia. Growth factor attach with the growth factor receptor and stimulate various signaling pathways and ultimately result into the proliferation of the cells, or stem cell directly can divide or form new mature cells. So this is the these are the mechanism behind hyperplasia.